I'm State Representative Theresa Mah. I represent the 24th House District, which is entirely within the city of Chicago and includes familiar neighborhoods like Chinatown, Bridgeport, Pilsen, McKinley Park, Brighton Park, and Back of the Yards. I've been the state representative here for the last 9 years. So I'm in the middle of my fifth term currently. And the demographics of my district, I represent a district that's made up of about a quarter Asian Americans, a little bit more than 50% Latinos, and the rest whites, with a tiny percentage of African Americans. Most of my constituents are also immigrants or their families. And in terms of socioeconomic status, it's more working families, lower middle class, working class folks. 2025, I think I'd probably best describe my priorities as the collective priorities of our Asian American Caucus. Our biggest priority was to make sure that we were able to secure resources and pass legislation that would be beneficial to the community as a whole. There are 9 members of our Asian American Caucus in the state legislature currently, and every year we get to advocate for the budget. And so the budget priorities that we really focused on really centered on resources for immigrant communities. So the immigrant services line item, the access to justice program, the parent mentor program, in terms of funding for senior services, increases to the community care program, things like that. Those were priorities that the caucus focused on. For myself, I actually had a piece of legislation from previous years that was able to get implemented this year. And so, I count that as an important accomplishment. That was a bill to create a pathway to licensure for previously licensed international medical graduates, and that was to address a healthcare worker shortage and increase access to healthcare by providing opportunities for those who had previously practiced in that profession. And so this was a long process that we needed to work along with IDFPR, our Illinois Department of Financial and Professional Regulation, in order to implement after the passage of the bill a couple of years ago. So that was a really important accomplishment. And then also I was able to expand the transit benefits savings program, which was also a bill that I passed initially a few years ago, but then this past session we were able to expand it statewide. And that's a program that allows commuters to purchase their transit fare cards, train passes through a pre-tax program through their employer, and encourages more ridership. So I would say those are 3 things that I'd like to highlight as priorities. There are so many different things that we work on that fall within our priorities, but those are things that I'm particularly proud of. I think that the work we did passing a balanced budget and making sure that there were resources in the budget specifically for our communities. In our cases, many of us were able to secure capital dollars for local community-based organizations in the district. And so I think that, that's going to have a lasting impact because we're supporting the organizations that have that serve the community more directly. And, so I think that the budgetary work that we did, not just getting capital dollars or operational dollars for organizations in our district, but then also getting funding for the immigrant services line item, for example, and making sure that there weren't any cuts to that. I think that that certainly probably has the most impact on my community since I serve a large immigrant community.
I know you mentioned the immigrant, the line item. Can you tell us a little bit more about that and what
Right.
sorts of services that provides?
So this is a line item in the budget that's existed for many years, and it's been able to grow. It was initially fought for by the Illinois Coalition for Immigrant and Refugee Rights. And so a large coalition of immigrant advocates fought for this funding that would be subgranted to immigrant serving organizations. And they end up helping our state agencies, like IDHS, provide a connection to our state services. So if immigrants needed to apply for benefits and they needed somebody to assist them in their own language, it's easier for them to go to their local immigrant serving organization and get those direct services rather than go to a DHS office where it might be harder to find someone assisting them in their language. So that's something that that's been a feature of our budget in Illinois for many years. But because of the growing representation for immigrant communities, both in the Latino Caucus and Asian American Legislative Caucus, we've been able to champion that particular program and to grow it and get more funding for it. Well, many of the same, but I think one new area that I'll be working more intensely on is trying to get a hold on. So one of the things that's new in the last couple of years is that I joined the Higher Education Appropriations Committee. And one of the reasons is I have a background in higher education myself, although, the last 6 years I served on the Elementary and Secondary Education Appropriations Committee. But for higher education, we're facing continuing increases in the cost of college education. And so, affordability and sustaining the quality of our institutions here in Illinois is really important. Some of my colleagues have been working on a revised funding formula for higher education to create greater equity across the state at the different institutions. And so, that's one thing that I'm excited to work on and look forward to that. In addition to that, I'm still putting together my agenda and priorities for the coming year. There are a few bills that I'm there are a few bills that I'm thinking of working on, but where they fall on the priority list is yet to be determined. one bill that, I've filed for a number of sessions already, but I'm hoping to move a little further this year, is the nurse staffing ratios bill. It is something that I've been working on in conjunction with the nurses unions. And, part of the objective is to increase patient safety, by, looking more closely at the workload of nursing staff, and, ensuring that they're not overworked and that they can focus on patient safety. So that's one of the things that is part of, my uh, focus on healthcare, accessibility, and just something that I know our communities always are always concerned about is healthcare access and safety. And so that's one of the pieces of legislation. And yeah, I know there are others. I'm just not, I haven't really focused that closely on what I'm going to be filing next year. Yeah, one piece of legislation that I did talk with Every Town for Gun Safety, which is an advocacy group. So they already have chief sponsors for this in the House and Senate, but I was excited to potentially be one of the chief co-sponsors. In any case, I would support this legislation, especially as it develops. But there's an interest in, banning or getting manufacturers to stop producing guns that can be modified with 3D printed high capacity magazines. Mm-hmm. So, that's, part of a whole slew of gun safety legislation that we're trying to pass in Illinois, to make our state safer and to, get the manufacturers involved so that this is happening at the source. Well, I would say that it's, not that hard to get involved, especially if you connect with an advocacy organization or a community-based organization that includes its clients in the advocacy process, because, then they can organize a lot of the activities for you, like going down to Springfield and or creating opportunities where you can communicate with your legislators. So, every year in May, we approve a budget for the state. And so that's something that affects every single person who lives in the state of Illinois. Mm-hmm. And if, you use any of the programs that are funded by the state, if you go to your local immigrant serving organization and take advantage of their programs, chances are, they get some state funding. And so your ability to continue benefiting from those programs depends on the type of budget that we pass and whether, we include increases or, whether there are cuts or, what have you. And so hearing from the people who actually benefit from those programs and getting a clear sense, from your personal story of, what something means to you, how important it is for you to continue receiving that service or benefit is something that, legislators really take to heart. And so when you have the opportunity, during the spring budget season to either, make a call, send an email, or visit your legislator's office or go down to Springfield, your voice really makes a difference in these decisions. And, I will tell you that coming up this coming year, we're going to be having to make some difficult decisions about, what to do about our budget, because, there are going to be some shortfalls and some decisions about, what to cut so that we can have a balanced budget, or, how to raise more tax revenue, and who to raise it from. And so those are all the decisions that we're going to be making that affect every single person in the state of Illinois. And so, your voice really matters when it comes to helping us decide, okay, well, if we're going to raise taxes, we're only going to raise them so they affect this group of people and not that group of people. Or we're going to cut this program but not this one, or we're going to add funding to this program because more people need it. These are not inconsequential decisions. And so, having your voice help us, really weigh the impact of these decisions, really does make a difference. And so I would encourage everybody to get involved and make your voice heard.